at least if you were born in the United States and sort of socialized, educated here, I can say with fair certainty that you were sort of socialized into a world to understand drugs and drug use in a very sort of black and white, like good and bad kind of way, right? People who use drugs are bad. Drugs are bad, right? So therefore, those people need to be punished. Their decisions are moral and bad. And so that has crept into our legal frameworks, right? It's not just that a number of people in this country think that syringe service programs that distribute syringes and take back used syringes and help people use safer are enabling. It is built into our laws, right? Federal funding cannot support syringe service programs. That's just one example, right? So our legal framework is stigmatizing. And there is no basis in public health for a law like that. We know that syringe service programs are incredibly effective at reducing transmission of infectious disease and a whole host of other things, right? And they are a dignified way for people who are using drugs to receive services from people who care for them. And so I think all that to say that it's not a surprise at all when you think that individuals and families and communities have internalized this stigma. It's because we've been taught this stigma. And so it's really about trying to understand what harm reduction is, why it is so effective, and then how you can participate. Because I promise that as soon as you start to be able to participate in it, you get it, right? And it fills you with so much joy because harm reduction is just love, right? And when you get to love other people, it makes you love yourself, right? And you love your community. So, yeah.